When people think about emergency response in the UK, they usually picture blue lights, sirens, and fast moving events that unfold over hours or days. What they rarely think about is the years of preparation that make those responses possible, or the systems that continue operating long after headlines fade. Emergency response in the UK is not an exceptional state. It is a permanent operating condition. Every day, organisations across the country assume that something will fail somewhere at some point. Plans exist not because failure is rare, but because failure is expected. This video explains how emergency response and national resilience actually work in the UK, using concrete examples from real incidents, real organisations, and real operating models. It is not about fear or drama. It is about how a complex society keeps functioning when parts of it break. National resilience in the UK is built on distribution. There is no single authority that commands all response. Instead, responsibility is spread across local responders, infrastructure operators, regulators, health bodies, local government, central government departments, and voluntary organisations. Each part of the system has defined duties. Each part assumes the others may be stretched. Resilience comes from overlap. The foundation of emergency response is risk assessment. In the UK, risks are identified and reviewed through structured national and local processes. These include risks such as flooding, heatwaves, pandemics, industrial accidents, cyber disruption, fuel shortages, power outages, and transport failure. Each risk is assessed for likelihood and impact. A flood in a rural area is treated differently from flooding in a dense urban environment. A cyber incident affecting a single organisation is treated differently from one affecting a shared service. These assessments shape planning. They determine what capabilities must exist locally, what must be available regionally, and what support may be needed nationally. Local response is the default. Police forces, fire and rescue services, ambulance services, local authorities, NHS trusts, and utility operators are legally required to prepare for emergencies in their areas. They know local geography, they know vulnerable locations, they know which substations matter, which roads flood first, which hospitals are under pressure during winter. Most emergencies never leave this level: a serious house fire, a local power outage caused by equipment failure, a burst water main, a train incident. These are managed using routine emergency procedures refined through experience. Local coordination is formalised through local resilience forums. These forums bring together emergency services, councils, health bodies, and infrastructure operators. They plan together, they share information, they run exercises. For example, a local resilience forum in a coastal area may regularly exercise flood response. It will identify evacuation routes, shelter locations, care homes at risk, transport dependencies. When flooding occurs, these plans are activated. People already know who to call, who leads, who supports. Emergency response uses structured coordination models. At the operational level, responders focus on immediate actions. Firefighters suppress fires, paramedics treat casualties, police secure scenes, engineers isolate faults. At the tactical level, coordination ensures these actions do not conflict. Resources are prioritised, mutual aid is requested. At the strategic level, wider consequences are managed: public messaging, transport disruption, healthcare capacity, business continuity. These levels interact continuously. They are practical, not theoretical. Communication underpins everything. Emergency services rely on resilient radio networks designed to operate during power outages and infrastructure failure. Mobile networks provide additional capacity but are not assumed to be reliable. Fallback systems exist. Command centers aggregate information from multiple sources: emergency calls, field reports, infrastructure telemetry, weather data. During storms, for example, responders may track wind speed forecasts alongside power outage data to anticipate where crews will be needed next. As incidents grow, escalation occurs. Regional coordination structures support multiple local responses. During widespread flooding, several local resilience forums may be active simultaneously. Regional coordination helps prioritize limited resources, such as rescue boats or specialist equipment. If incidents threaten national stability, central government becomes involved. This involvement is focused on coordination and support, not taking control of operations. Departments support their sectors. Energy departments work with power operators. Health departments support NHS coordination. Transport departments address network impacts. Cabinet office functions integrate information to provide a national picture. Emergency powers exist but are rarely used. The system is designed to function within normal law. Infrastructure operators are central to resilience. Power companies maintain fault response teams and control rooms. When storms damage overhead lines, engineers are dispatched based on priority. Hospitals and emergency services are restored first. Water companies manage supply through network reconfiguration and pressure management. Telecommunications providers deploy mobile masts and reroute traffic. These actions are coordinated with emergency services. Cyber incidents are treated as operational emergencies. A ransomware attack on a hospital, for example, is managed alongside patient safety concerns. Systems may be isolated, fallback procedures activated, specialist teams assist recovery. The focus is restoration. Public communication is essential. Authorities provide updates that balance accuracy and reassurance. During fuel supply disruptions, for example, messaging may focus on discouraging panic buying. Poor communication can worsen incidents. Voluntary organizations provide critical support. They run rest centers, deliver supplies, support vulnerable people. Their role is planned, not improvised. Recovery often lasts longer than response. Rebuilding infrastructure, supporting displaced residents, addressing economic impact. After major floods, recovery can take years. Lessons are formally captured. Reviews examine what failed and why. Recommendations lead to changes in planning, investment, and training. National exercises test the system. They simulate complex, prolonged scenarios, multiple sectors, multiple regions. Exercises reveal gaps safely. Resilience is about continuity, not perfection. The UK approach accepts that systems will fail. What matters is speed of detection, quality of coordination, and ability to recover. Most of the time, this work is invisible. When it succeeds, daily life continues. That continuity is the outcome of constant preparation. This is how emergency response and national resilience actually work in the UK. To understand how this system behaves under real pressure, it helps to look at concrete case studies where emergency response and national resilience were tested over extended periods. One of the clearest examples is widespread flooding. In recent decades, the UK has experienced repeated flooding events, affecting large areas simultaneously. These are not sudden disasters. They build over days. Rainfall saturates ground, rivers rise, drainage systems become overwhelmed. Local responders often begin work before flooding peaks. Sandbags are deployed, pumps are positioned, temporary barriers are erected. Local authorities activate rest centres in schools or community halls. These centres are pre-identified in resilience plans. Staff know how to open them. Voluntary organisations know when they will be asked to support. As flooding spreads, coordination scales. Multiple local areas may be affected. Regional coordination helps prioritise resources, such as high-capacity pumps or rescue boats. Decisions are made about where intervention will protect the most people or the most critical infrastructure. Hospitals are prioritised, substations, water treatment works, transport hubs. Recovery from flooding often takes months or years. Homes require drying and repair. Roads and bridges must be inspected. Insurance processes interact with local authority support. Lessons from each flood feed into changes in planning, flood defences, and building standards. Another instructive case is severe winter storms. High winds bring down power lines, snow blocks roads, ice affects rail points. Power companies monitor weather forecasts closely. They pre-position engineers. They stock materials. When outages occur, restoration is prioritised. Hospitals, care homes, emergency services, remote communities, telecommunications providers deploy mobile generators to keep masts running. Local authorities activate gritting plans. Police manage road closures. Public messaging encourages people to limit travel. Storm response is iterative. Crews restore power in one area while outages continue elsewhere. Coordination reduces duplication and ensures safety. The system accepts that full restoration may take days. Pandemics provide a very different test. Response is prolonged, pressure is sustained, healthcare capacity becomes the central concern. During a pandemic, emergency response shifts from discrete incidents to continuous management. Hospitals reorganize services. Elective procedures are delayed. Supply chains for medicines and protective equipment are monitored. Data becomes critical. Case numbers, hospital admissions, staff availability, government coordination focuses on enabling the system to cope rather than resolving a single event. Local authorities support vulnerable populations. Voluntary organisations deliver food and medicine. Recovery is gradual and uneven. Reviews examine preparedness, data sharing, and decision-making. These lessons shape future planning. Cyber incidents offer another lens. A ransomware attack on a local authority or hospital can disrupt services instantly. Systems may be taken offline. Paper procedures are reactivated. Emergency response focuses on maintaining critical services while technical recovery begins. Specialist teams assist with containment and restoration. Public communication manages expectations. Cyber incidents often reveal dependencies that were poorly understood. These insights feed into resilience improvements. Fuel supply disruptions illustrate behavioral dynamics. Even small supply interruptions can lead to panic buying. This behavior can create shortages that did not exist initially. Emergency response includes coordination with retailers, logistics providers, and public messaging. Clear communication can stabilize demand. Poor communication can amplify disruption. Transport incidents show another dimension. A major rail failure during peak hours affects thousands of people. Emergency services manage safety. Rail operators manage recovery. Local authorities manage crowd movement. Communication reduces frustration and risk. Lessons lead to infrastructure upgrades and revised maintenance regimes. Across all these cases, common patterns emerge. Early detection matters, local capability resolves most issues, coordination scales when needed, clear communication reduces harm, recovery takes longer than response, resilience improves through learning. National resilience is therefore not a single capability. It is an ecosystem of people, systems, plans, and relationships. It evolves continuously. It is never finished. This is why emergency response and national resilience in the UK look cautious, procedural, and sometimes slow. They are designed for endurance, not spectacle. That endurance is what allows a complex society to absorb shocks and continue functioning over time. Two further case studies help illustrate how different types of stress test the same underlying resilience system in different ways. One example is a large-scale telecommunications outage. Telecommunications failures rarely affect everyone equally. They often begin with a software update, a configuration error, or a fault in a core network element. When this happens, millions of users may lose voice or data services simultaneously. Emergency response begins inside the telecoms operator. Network engineers identify the fault, traffic is rerouted, rollback procedures are activated. At the same time, emergency services assess impact. Loss of mobile coverage affects emergency calls. Fallback routing is enabled. Police and local authorities are notified. Public messaging becomes critical. People are advised how to contact emergency services if normal channels are unavailable. Hospitals check internal communications. Infrastructure operators assess dependencies. Regulators monitor restoration progress and ensure prioritization of critical services. The incident may be technically simple but socially complex. Restoration speed matters less than clear communication and safe workarounds. After recovery, reviews examine why redundancy failed and whether design assumptions were valid. These lessons feed into network architecture and regulatory expectations. Another example is a prolonged heat wave. Heat waves place simultaneous stress on multiple systems. Electricity demand increases due to cooling. Rail infrastructure expands and deforms. Road surfaces soften. Water demand rises sharply. Healthcare services face increased admissions. Emergency response during heat waves is slow burn rather than acute. Monitoring focuses on trends, grid stability, reservoir levels, hospital capacity. Local authorities activate support for vulnerable populations. Care homes adjust staffing. Public messaging focuses on hydration and heat safety. Infrastructure operators adjust operating limits. Power stations may reduce output. Rail services impose speed restrictions. These decisions trade efficiency for safety. Recovery is gradual. The event ends quietly. But lessons are significant. Heat resilience becomes a planning issue. Design standards are reconsidered. Assumptions based on historic climate conditions are challenged. Together, these case studies show that resilience is not about reacting to one type of crisis. It is about maintaining coordination, judgment, and adaptability across very different stress conditions. This adaptability is the core of how emergency response and national resilience actually work in the UK.